I have never experienced anything like I experienced in Gaza, and I hope that I never do ever again. I'm Andy Ferguson. I'm a GP and public health specialist, and with that work I've been a regular traveller to both Gaza and the Westbank for the past 14 years. Over Christmas and New Year I was there as part of a 4-person team. We were based at the European Hospital in Khan Yunis for that entire 2-week period. Complete chaos reigns. There are about 22,000 people currently living in makeshift tents on the grounds of the hospital or actually on the floors in hospital corridors themselves. You've also got some of the remaining staff living within the hospital, some of them with their families as well. The situation within the emergency department particularly was chaotic. There were hundreds and hundreds of patients in there at any moment. Many of them, because the primary healthcare system has broken down, looking for the ongoing management of their diabetes, high blood pressure, heart failure, kidney failure, cancer. And then on top of that, then you get groups of 10, 20, 30 newly injured patients, often with a number of dead bodies, arriving within that chaos. By far the greatest number of injuries are those affecting the limbs. You can't imagine really the horror of some of those injuries. People who've had traumatic amputations from the blast itself of arms, legs, the most horrible, complex, devastating fractures, affecting their limbs as well. There are chronic shortages of essential equipment, drug supplies. Whilst we were there, day by day, those supplies were running out. And on our last day in theatre, our team themselves used the last dose of morphine and also the last dose of pethidine. So any of those stronger opiate painkillers at that point in time had completely run out. There is intense fighting going on around the European hospital at all times. So throughout the day, whatever you were doing was accompanied by bomb blasts, the sound of tank fire, machine gun fire in the surrounding streets. The level of devastation, the complete dismantling of the health system from the hospitals down to the primary healthcare centres to the vaccination programme and public health initiatives, none of it is functioning. In the past, whenever there has been a major escalation in the conflict, we've talked about a recovery period of maybe 2 to 3 years, but we're now talking about probably 2 to 3 decades, and that may be a conservative estimate given the level of destruction which is there.